Good morning. Welcome to Carolina People. This morning we're at the Holiday Inn, Hard Rock Parkway. We're focused on HIV and AIDS in the African American community, and we're visiting with the Region 6 Director for the Department of Health and Environmental Control, Dr. Covia Stanley. Good morning, Dr. Stanley.
Good morning. How you
Thanks
doing?
so much for coming in early on a Tuesday morning.
Okay.
A lot going on. I'm sure things keeping you busy, but to come in
Yes.
here, and this is a real serious issue.
It is very serious.
Something that a lot of folks, I don't think, understand the significance of the numbers there and how it's just critically ripping through parts of the community, but particularly the African American community.
That's true, yes. Certainly, as we were talking earlier, we know that HIV and AIDS has grown in epidemic proportions, particularly in the African American community. The African Americans are about 13% of the population, yet we make up about 49% of those folks who have newly acquired HIV and or AIDS. Must make a distinction. HIV is the human immunovirus, which eventually can lead to the AIDS, the acquired immunodeficiency syndrome.
Right.
And we know that people who develop HIV can live a long time. Magic Johnson is a typical
Great example. Yeah.
Yes. What I want to focus on, though, is trying to help people not to get that.
Right.
We are living in a time where sexuality is not looked upon as something that can be potentially fatal. You've heard the reports in the last month or so about teens 1 in 4 having STD. And
is that right?
Yes. And when we think in terms of STD, of course, that includes gonorrhea, syphilis, chlamydia, herpes, HIV, and AIDS. And of course, we have to include hepatitis C, which can be very debilitating to young people. And the interesting thing about it is the HIV and AIDS can be prevented. We have the education, we have the medication, we have condoms and other modalities of therapy. But we just need to get it in folks' mind that I must make this positive change. For too long in the African American community, we have not talked about sex as we should. And we know that in the churches, people just do not want to talk about it. But I'm here to say that as a seminary educated pastor, as a gynecologist, as a healthcare professional, we need to let folk know that we must talk about sex in the church in a culturally sensitive way. We need to get our heads out of the sand because young people are having sex now between 3 and 6 o'clock in families' homes. And many times they do not think that it's going to happen to them. They practice this philosophy, it's not going to happen to me. Invincibility.
Yes, which a lot of teens, a lot of others, a lot of adults clearly feel that way.
And
clearly feel that way. And of course, I've got to highlight that great example you just laid out. A lot of folks that are MDs themselves, gynecologists would be particularly, if that's all they did, they'd be particularly capable of speaking about this. A lot of pastors, if that's all they did, they'd be particularly capable of speaking about this. If they were healthcare professionals or DHEC directors, they'd be particularly capable. You wear all 3 of those hats, all 3 of those hats. So what better person than to talk about this issue than someone dealing with folks both on Sundays and every day of the week when you're reaching out with the Lord, both on a healthcare side as well as a person who's obviously practiced and seen a lot of special situations with women and men as a gynecologist and obstetrician.
Certainly we cannot educate enough, and as we were talking earlier about the pets, you know, I think that's very appropriate. Prevention education, treatment, and support.
And support.
Over the past few years, we know that people who have HIV or AIDS have been stigmatized.
Right.
You know, as queers and other names. And
Sure.
People have said that they're the scum of the earth, and
Right.
they got it. God cursed them because they did not act right. But the point is that some people got it being innocent. For example, Arthur Ashe got it through contaminated blood transfusion.
Right.
So we who do not have it are just blessed at this time.
Right.
What we want to emphasize, though, if you know that you are engaging in activity that could be very possible for you to pick up AIDS or HIV, it'd be best for you to refrain. And what we do recommend is having a monogamous relationship.
Right.
Of course, first of all, for young teens, we recommend abstinence.
Oh, yeah.
When that cannot be practiced, of course, we do recommend the use of condom.
Right.
And certainly the latex condom, in contrast to the sheepskin, because the latex does have the closer pores so that the virus does not pass so readily. And of course, as I talk about the use of the condom, it will help contain the virus which is in the ejaculate.
Right.
And as I tell people talking about withdrawal.
Oh, yeah.
The fact is that first ejaculate is heavily loaded.
Is that
with
right?
The virus.
With all the virus.
Yes,
wow.
Yes. And
it's important that viewers take the time to sit here and listen to this, because obviously they're not hearing it oftentimes in church. They're not hearing it in their homes.
Right.
They're not hearing it necessarily at school. They may hear it at DEC, or if they go to pregnancy support service type locations, they may be hearing this, but it's important at 7:10 a.m. on a Tuesday morning, if they want to rush off to work, that they find a way to get back to somebody like you or to Care Team, another great group, to learn more about these basic things. They better start thinking about them, because if it's not happening to them, it's going to happen to a neighbor, it's going to happen to a loved one, it's going to happen to one of their children potentially, or their grandmother. I mean, one of the startling facts that Johanna Haynes gave us recently when filming with us at HTC was the idea that 11% of new cases are heterosexuals over the age of 50. And you sit back, how is that possible? And the idea was a lot of folks married, split up, they've been in monogamous relationships for 10, 20, 30 years, they split up, now they're out dating. They're not used to having had any protection for years. Easy to fall in that trap and easy to pick up AIDS, pick up HIV and later AIDS.
Yes, and where Ms. Haynes is referring to, certainly, as I remember, the 60s. You know, basically the STDs was gonorrhea, syphilis, and you could treat that easily with penicillin.
Right.
And now, as we said, we do not have the monogamous relationships, and of course you have the additional burden of HIV, chlamydia, and all these other viruses, hepatitis B, hepatitis C. And the sad part about it is that our behavior is so, I guess, liberal right now that we have sex with 2, 3, 4 other people. Each of those persons had sex with that many people. So by the time this 55-year-old lady who is divorced or a widow has that one time with that hump for women, and of course for the man, the bad mama jamma. You know, you know, they have sex with somebody who's had it with several folks, and it just increases the chances for that one time.
Big domino.
Yes, big domino. Yes. And the sad part about it is that they don't think about this, and it progresses so that it does become AIDS. And I'd like to think and focus on the pathology. Once this virus gets into one's system, over a period of time, it breaks down the immune system, what we call the reticuloendothelial system, which are the plasma cells and the cells in the bone that are generated, the white blood cells.
Right.
And we have special cells that come from the bone or reticuloendothelial system, such as the plasma cell,
right.
the lymphocyte,
right.
which eventually becomes broken down, weak, and they cannot fight the germ as they formerly did.
Right.
And therefore the immune system just becomes so weakened. So we have a low T cell count. The viral load is increased,
right.
and all that. And so all these, as they add up, makes it difficult for the patient to begin to have good quality life. And we thank God that they do have medications now that help folk to live longer, in contrast to several years ago where people were destined to die, prematurely.
Right.
And so we know that we must help people to understand, particularly the seniors. You have to know what the sero level is of your partner. There's nothing wrong as have you been tested.
It is Johanna and I talked about that off camera, the difficulty of that aspect if someone is going to not abstain first, if they've decided they're going to be in a relationship, monogamous hopefully, but possibly going into multiple relationships, just to make sure and ask that question, whichever side you're on. If you're the male, ask it, have you been tested? If you're the female, and you hate to say it, but oftentimes just making sure they really have. I mean, or go together. Go together. Because ultimately, if you find it out, you can possibly treat yourself earlier, and then the support begins to kick in. Supporting your loved ones, because of course, as you said early on, that aspect was this was always a homosexual man's disease. Now you give examples like Magic Johnson. He's not a homosexual. Arthur Ashe, clearly getting it from another thing and not it. But even if they were, it's not just a homosexual man's disease. Clearly, a lot of women, the highest incidence now in young African American women. And she gave those figures, and they're startling. CareTeamSC.org, CareTeamSC.org. But still, the other special thing there, and I understand you're with DHEC and clearly as a pastor, so you're speaking about it for wearing a lot of hats, but wanting folks to get in and get tested. Just get tested. And they can do a swab now. Just swab in your mouth.
Oraquake is a good way to test, and we thank God for people being able to go to places where they can be anonymous testing. Because I know that stigma. You go to that van or go to this site, people automatically assume. But certainly prevention, as they say, is worth a pound of cure. And we just can't emphasize enough to everyone who is in a relationship that's not monogamous to check yourself. And of course, as a gynecologist, I know that the American Medical Association back there about a decade ago has really encouraged all physicians who are taking care of women to at least offer them the HIV test annually. As a gynecologist, a woman who comes in with chronic moniliasis or candida vaginitis or yeast, that should raise the antenna that she must be tested to rule out being HIV infected, because that is something that can be treated.
I think one great thing, Dr. Stanley, I hadn't thought about that before the interview, but getting a group of men and women, heterosexual or homosexual, but particularly a heterosexual group of men and women, and taking the time for them all getting together and going and getting tested together. Good role models in the community. And I bet there'd be a real, as you said, probably some folks who wouldn't want to do it, but I bet we could get a group together, and that would be a great story, TV, radio, and print, to highlight a group of folks who care enough about people around them. Because the sooner you get checked out, probably the more long your life will be, if you found out you're positive.
And certainly this is something we are working toward.
Right.
I have several pastors that I'm working with to see what we can do.
That's great, absolutely. And very important. I understand care teams working hard to try to reach out into the African American community.
Yes.
You used the word epidemic earlier on. I guess, is that, I mean, is that, are you?
Well, actually, it's become an epidemic proportion because, as you said, women between ages, say, 24 and 44,
right,
and mounting numbers.
They really are.
HIV and AIDS, and it's certainly a heterosexual way they received it.
Yeah.
And so we don't want folks to just think that it's just men who have sex with men type thing. You know, it's very heterosexual.
Yeah.
And some reports that I've read show that of the African American babies that are born, 81% of them are born from these women who have been infected. So if we have women that go to the obstetrics office in the first trimester of pregnancy, they can be placed on medication, AZT and others, which could help prevent that baby from developing this condition. So is the need to know.
Another critical aspect there. And support. You highlighted that acronym, PETS.
Yes.
Prevention first.
Yes.
Education beginning, middle, and end.
Yes.
Treatment, obviously, after you found out. But support.
Yes.
A big thing. You think about the family members, again, because of the stigma.
Yes.
That it's a homosexual man's disease. The family members have to go through that when clearly it can be a heterosexual issue. The loved ones, the people around them, the ones that are worried, oh my Lord, maybe I have it. I mean, a lot of support has to happen.
Right. And certainly in the faith community, as I have told folks, you know, we make folks feel alienated. They come in on that side of the pew. People know their condition. They'll sit on the far end. I said, now we got to start showing that love that they are made in the image of God, and just by the grace of God, we don't have it, you know, but we got to show those folks that we love them.
That's right.
And I remember my experience when I was a director of health in Richmond, Virginia. My pharmacist gave a patient the medication that was in a different size container. I got a call from this patient's partner, very upset, concerned, because there was the perception that we were hastening that person's demise by decreasing the amount of medication they got. So when I talked with the pharmacist, she did tell me that she gave the same amount of medication, but she did not have the large bottles or containers that she had been given previously, so it was in a smaller container. Therefore, when the patient got home and the partner saw that, the first thing was, you know, you're shortchanging me. You know, but we had to clear that up. So what I'm saying, these people do go through some mental changes, depression, anxiety, paranoia, and all these. So we have to show that compassion, that sensitivity, that cultural competence.
Absolutely.
Love.
Love. And that's whether Christian or not.
Yes,
that's
exactly whether Christian or not. Well,
we got about 5 minutes, Dr. Stanley, and I know you recently gave a speech or talk about the same issue. And number one, got to get the head out of the sand. That's very important. Whoever you're talking to, but learn all we can about the disease and people that's affected. Establish the ministry in the church. Establish an AIDS ministry in the church, and how you go about doing that. Lord only knows. What are I mean? Clearly, there's got to be some obstacles there.
And first of all, is with education of the congregation. And in our case, I would like to say that we have an association or a union, which consists of 37 churches. Since we have high mountains to climb on education, you know, we try to get very interested people from different churches to work together. As I said, I have 3 pastors in the association who are very amenable to working with me to see what we can do to establish ministry. And the basic thing is letting the folks know that these people need somebody that they can sit down and look at their eye level. You are somebody. You know, go to their home, and then we can help with getting collection to give for them to buy toiletries.
Sure.
And also support programs such as Care Team.
Yes.
There are other programs called Balm and Gilead, which is headquartered in Richmond, Virginia, that has the faith community to meet and have prayer week the first week of March. There are other programs going on, and of course in South Carolina we are working closely with the AME Church, African Methodist Episcopal Church, and we just need to keep pulsing the information to folk that these are our family members, and we must help them to understand that they must take charge of their health.
When you think about that aspect, clearly for you as a medical professional, having seen how quickly a disease can get in your body and just tear your body up, so knowing how critical it is to be there to support them as they're, as you said, oftentimes potentially depression or other symptoms that will go along with that. So to be there for them, but to know as a medical professional how quickly it moves, how important it is to get it out there, whether you've known someone personally or a loved one that's been impacted. Clearly somebody out there in our viewing audience has been, and they know people that are. Yeah, don't wait for it to happen in your family or to yourself. You know, they're somebody else's son or daughter. Absolutely.
You are extended family.
What was it, something in your childhood that got you interested in becoming a pastor, and surely becoming a medical professional? We think about finishing high school there in Charlotte, ending up in the Triangle, I think seeing SUNY Buffalo, where you finished med school, doing residency at UNC Chapel Hill. Clearly you've had a pretty tremendous background there, and studying for the MDiv there in, I believe, in Richmond. I mean, you've had a lot of schooling. What was it that got you interested in becoming an active pastor?
Well, I started preparation for medicine in the 5th grade. That's all I wanted to be, was a doctor.
Wow.
The thing about being a minister never
it was always a doctor.
Came to my mind. And I was called, I remember my senior year in pre-med, but I still did not think of me being a minister. I was going to be this rich, famous doctor.
Well, you've done that.
And I ran 16 years. God allowed me to have a nice practice. And at a particular point where I just worked myself to exhaustion, and while I was recuperating, I think that was the way he got me. You know, that Damascus Road experience. I told you, you are supposed to be a minister, carry my gospel. While I was there, I said, okay, you get me out of here.
I love it.
I'll do it.
So
and the thing about it is being able, when I went to Richmond and went to seminary, that's when I was able to blend
private health or public health and ministry. That's tremendous. And clearly South Carolina wrapped around that idea. And it is critical. How better to reach folks about their health as a medical professional, but B, from the pulpit. And not to say that you would necessarily intentionally mix them together,
but you don't.
Because you do work for the state, but clearly the state recognizes what you do on your own time is entirely up to you, and as a medical professional you're that first, and but in God's eyes we know what you are first. That's right.
I think it was destined for me to do so because I was involved in the American Public Health Association Faith Health Caucus in 97 and 98 in Boston. And when I moved down here in 98, the Kellogg Foundation, Robert Wood Johnson, had a turning point. And the Health Faith Initiative. So that was a perfect crossover for me, a great transition. And so at that point, that's when we were able to blend the two, and I told my staff that we look for holistic care, not just medical, but also the dental, mental, and most of all spiritual, because we know that whether the person's supreme being is Jehovah, God, Allah, you know, there's a supreme being, but we know healing begins from in here, your faith.
Dr. Stanley, could you have ever imagined, even in the 5th grade, when you determined I want to be a medical professional, that you'd be here today making this kind of a difference for folks both in your congregation as well as in this 3-county area, Horry, Georgetown, and Williamsburg, counties that really need DHEC and DX support.
I did not have any idea. Not in my wildest imaginations. This is a result of being obedient to God.
Those are great words.
And I'm happy.
That's very simple. That's right. And we can see that in you, both the smiles here and the smiles when folks have a chance to meet you. I'm sorry we've run out of time.
Okay.
Thanks so much for being with us this morning. Stay tuned to a little more with Dr. Covia Stanley and the significance of this impact of HIV and AIDS in the African American community. Coming up next. Is he a typical Union High School graduate? I don't know. He may or he may not be. Goes on, finishes college, finishes med school, finishes residency, has a spectacular private practice, goes on, even wraps up a master's in divinity. What's he doing now? He's telling people to get their heads out of the sand. Get your head out of the sand. Think seriously about something that's growing in epidemic proportions. You can make a difference, but you've got to learn more about it. Take the time to be educated about HIV and AIDS, the serious facts and figures he was providing. African Americans making up 13% of the U.S. population in 2005, but 49% of estimated figure, 49% of new cases being diagnosed with HIV, later going on to AIDS. Take the time to learn more, be involved. You can prevent it, but you've got to get the education. Dr. Stanley's making a difference every day, stepping out to make sure education's provided, but there's still going to be treatment and support. Thanks so much for everything you do.